Dentistry.One is a platform and solution that will bring virtual first dental care that can transform oral health and broadly link and improve overall health through starting with the mouth. Again, thank you. My name is Brant Herman. I'm founder and CEO of Dentistry.One. I'm also the founder and CEO of MouthWatch, which has been a long-time participant in StartUpHealth. Dentistry.One is a platform and solution that will bring virtual first dental care that can transform oral health and broadly link and improve overall health through starting with the mouth. It's a new venture. Fundraising would be into this new venture of Dentistry.One, which is a separate LLC, but backed by the proven performance of MouthWatch. We are an $11 million company as of last year in revenue. We've won 3 Inc. 5000 fastest growing private companies. Our hardware and software is currently in over 40,000 dental practices around the country. And we have key investors, including CareQuest and StartUpHealth. We've got a clean cap table and no debt on the MouthWatch side. This would be going into Dentistry.One, which just started booking revenue this month. Dentistry.One is a complete oral health virtual first platform. We have a nationwide network of dentists who are trained in telehealth specific application for oral health care. We can conduct member and patient engagement and outreach services that allow us to get more patients activated and allow insurance plans and programs to actually touch more lives than they're currently getting waiting on an in-office visit. We complete their journey with our care advisors who support patients with care coordination and booking them appointments in offices when treatment is needed. We also help them understand their confusing dental benefits. We have an infrastructure that's built for EHR integration, so we can trigger notifications and engagement based on systemic health conditions, such as diabetes, pregnancy, chemotherapy, conditions where there are significant improvements and cost savings that come from connecting that patient to oral health care. We're incorporating AI for wellness screenings and a smart patient intake, and we also support overall health through oral health coaching and education. You might wonder what can be done via teledentistry. It is different than telemedicine, but there's a lot that we can do. We're doing live and asynchronous consultations with patients. We can do emergency triage. We can divert cases. There's 2% of ED admissions are for oral health conditions. We can divert many of those and get them treatment online and then schedule an appointment in a dental office. New patient consults, cosmetic and ortho evaluations. A key area for us is helping increase HEDIS scores for annual dental visits for plans that cannot meet capacity through their current dental networks. There's other great services that we can offer. We see a vast market of addressing dental insurance on the commercial and on the public side. We have corporate wellness programs where we're going direct to employers, supported existing teledental opportunities, and the ED diversion space. Our team are proven leaders in teledentistry. MouthWatch has been a leader in the space for 12 years. We realized we needed to bring care delivery directly to teledentistry, hence our ability to start a national DSO with 50 states of care delivery opportunities, and then that referral to practices. We've got existing traction. We've signed Health Plan of San Mateo with 180,000 lives and are in final stages of contract negotiations with Involve, which has 4.4 million lives, Advantage Dental, some Care Mobile, key client opportunities, and we really see these 5 verticals of insurance, dental service organizations, benefits, health systems, and oral health products. And we're looking for $2 million, ideally as a convertible note, to help us scale and really finish out the platform, finish the operationalization of professional corporations and get this going so we can deliver care to millions of Americans who need to connect to better oral health care. Thank you so much.
You know, Brant, it occurs to me that sometimes as a patient, I think about my dental care differently than I think about my health care, but they're inextricably linked. Can you talk about how Dentistry.One integrates with the larger healthcare system, and how does it result in better outcomes?
So we know that there are over 60 systemic health conditions that improve outcomes and cost savings when oral health improvements happen. So inflammation is a big indicator. When you can manage inflammation in the oral cavity, you have improved outcomes. We know that diabetes, pregnancy, Alzheimer's, autoimmune disorders, chemotherapy, there are so many chances where we can improve that outcome for a patient. The challenge is the siloed nature of medical and dental puts the burden onto the patient. So we see integration with Epic, Athena Health, Cerner as some starting points that when we see a diagnostic code for a chronic condition tied to oral health improvements, we can now push a patient engagement, messaging, education, and then connect them to a dentist and ultimately care coordination.
Dr. Steve Marin, good to see you on the call today. Are any ERs contacting you when they have dental patient emergencies? Are you guys providing dental backups to any health systems?
Yeah, so with our launch at the Health Plan of San Mateo, they're considering incorporating a QR code in the emergency room that could initiate a video consult with a dentist credentialed with their plan before the triage nurse does intake. So we're looking at ways that before, and then the other part is by incorporating into part of their general benefits, they're knowing about a teledentistry consult option before they even go to the emergency department.
Mike Maschek from Inception Health also asked, more broadly beyond the emergency department, are there other ways that you work with healthcare systems, to provide a broader base of care?
Yeah, I think still having that virtual first intake becomes key. We know about 54% of doctors have said there's no satisfactory referral system for dental from a medical setting. So within a normal healthcare system, there's a much greater ease in referring to other medical specialties. We think that's where a custom intake page for that specialty. So if someone's going into chemotherapy, let's get them on a chemo intake page, understand that, and then we're going to do that virtual consult, whether it's in that office appointment or followed from their medical appointment, and we can make sure we then get them preventive care, whatever is needed to make that medical outcome improve.
Health equity is a big issue, Brant, in today's healthcare system. How does Dentistry.One specifically access or impact access to care? And, what's the revenue opportunity from increasing that access?
Yeah, I appreciate that. So we see huge provider shortage areas in this country, especially on the dental side. We think whether it's an urban setting or a rural setting, when you can eliminate the barriers that include cost, fear, and distance with a text message, an email, or a quick URL, we can get a patient, one, that initial access to a dental visit and an understanding in a non-judgmental, non-anxiety inducing consultation. We can then facilitate smarter referrals and care coordination to get those patients in. Our revenue model is primarily through the margin on the consultation fee and our contracted rate with our doctors. And that varies depending on state Medicaid. There are also other bundled services we can offer, such as a caries risk assessment, smoking cessation, oral hygiene instruction, a range of services. And then we also see opportunities to deliver preventive care directly to patients through delivery of fluoride varnish, high fluoride toothpaste, mouth rinses, services that can help keep that patient from coming in, and also address, let's say, a perinatal population so that they're healthier, their babies are healthier, and then parents have a better understanding of ways to keep their kids healthier and cavity-free.
Brant, just really quickly, how does the structure of what you've created with Dentistry.One create a real competitive advantage or differentiation versus the other folks out there that are trying to compete in the same space?
So dentistry is not as advanced in medicine in terms of interstate compacts. So what we've had to form are professional corporations across all 50 states, and then have dentists contracted with those. So each dentist has to be licensed in the state where they're seeing that patient. It's a little bit trickier, I'd say a lot trickier than an interstate compact, which would be wonderful, but is really challenging. So we've created this national network and the ability to deliver clinical care. There are a couple of states that are still evolving in their teledentistry policy, but by and large, 48 states are allowing the delivery of care. One of the lasting benefits of the pandemic and the public health emergency, a lot of those policies have remained in those states.
think we have another question coming in from the audience here. Sheila Owens Collins, are you able to see the inside of the mouth on your teledental visits? How does that work?
Yeah, it's a great question. So when we started 12 years ago, we approached this with the idea of a camera going to the patient that was cost prohibitive, but we have found that through your smartphone, through a series of 5 images of your oral cavity, you can get a really good picture of oral health conditions. We also have AI that's coming out in Q2, which will help address and identify inflammation, recession, plaque, and potentially caries. There are devices we're looking at that are affordable that could be delivered right to a patient or member that would give them a much better intraoral image, and then guide the dentist for more precise knowledge. We still know in most cases, if we see an issue, that's a key part of our care coordination, is we want to make sure you get into a clinical office for treatment.